Well, good morning, everyone. How are ya? And once again, welcome to another live this morning. Hope you're having a great start to your day and President's Day in the US of A and Family Day, at least in Ontario, Canada. So, hello, Andrea, numero uno, Brahim, how are you, my friend? Having his coffee. Carol, West Virginia. Elena, how are you? Janice in Brampton. And Nick from our staff, good morning. Judy, New Brunswick, how are you? Lynn from Aurora. Did you guys get any snow? Rosa, Montreal, Norma, Texas. And Sherry from Mississauga. Leela from Verner. Sandy from Vancouver, Washington. Merrill, how are you from Ottawa? Rolly, there he is, our friend from England. Diane from LaSalle. Cheryl, West Virginia. And Brahim saying it's pretty warm out in Portland there. Fran, how are you? Orangeville. Linda from Uppsala. Barbara from sunny Thetford. Chantal, Ottawa. And Georgie, Halifax, Nova Scotia. Kim from Utterson. Where's Utterson? Regina, how are you? Alan, Manitoba. Donna, Belle Ewart. Marilyn, PEI. Grace, how are you? Nice to have you on. Laurie, Cambridge. And Bonnie, Little Britain. Adeline, good morning. Thanks for coming on. We appreciate it. Maureen, good morning to you. Francis from Vaughan. Dave, Cardiff. Sandra from Aurelia. I know you guys got a lot of snow in Aurelia. Barbara, Rita. And Derek, bonjour. Larry, Huntsville. Snow, 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 right? Sue, St. Petersburg. Sudbury really got it. Donna, Newfoundland. Kim, Port Sydney. And Lisa, good morning. Couple of more. Alan, minus 49. Where are you, Alan? Bruno. And Darlene from Saskatchewan. Heather, Miramichi. Cheryl, sad to be home from Antigua. Yeah, what a difference, eh? Linda, we love those Lindas. Carol and Tina, Nova Scotia, and Dorothy. Okay, let's get back to questions, guys. Thanks for coming on. We appreciate it. Just going to finish up on Friday. Now, listen, guys, I have been asked every week about methylene blue, okay? Now, again, I just got to give you a little background. When I had my radio show for over 20 years, every week, just about, I don't think any exceptions, I always got stuff coming across my desk and people wanted me to promote or they asked me about it. And I, of course, because I had a venue, a radio show, people wanted either to ask questions about products, which we love, and or promote a product. And, there was something on the hit parade. I can tell you it was unreal. Like almost weekly, I had someone trying to get me to endorse products or whatever. Okay, so obviously, I've been in practice. I was in practice for almost 50 years. There really wasn't much new under the sun. Now, methylene blue, okay? It's a dye. It's synthetic. And I'm not telling you it's got no benefits because I never used it in my practice. But, I spend a lot of time researching, reading, constantly keeping up to date. And it's sort of the newest thing you can order it from Amazon. Can I tell you? I don't recommend it. It's synthetic, first of all. And even if it's good, let's say it's good, there's nothing wrong with it. There's no real side effects to it, although I've read some side effects of it. But let's say everything is good. And you know how I operate, guys. Good, better, best. So I was reading, it's got benefits for UTI. Okay. I know what's better for UTIs, probiotics. And I'll tell you why. Because probiotics, broad spectrum probiotics, are better because at the end of the day, if you get recurring urinary tract infections, almost invariably, it is yeast. It's a fungus. It's not a bacteria. Okay? And I understand methylene blue has some antimicrobial benefits, but nothing like probiotics. Nothing like probiotics. Like when you get certain strains like L. reuteri and L. rhamnosus and others, they're better for you. I've read that there's some cognitive benefits for methylene blue. Yeah, well, there's things a lot better than that for your cognition. The combination of Navitol and high DHA oil, I'd put that up against anything when it comes to cognition and cognitive function. So again, I don't mind answering the question. I mean it. I would rather you ask than not ask. I really mean that. We have an open forum here. We want you to ask questions, and I encourage it. But I'm not recommending methylene blue. I'm just not. You want to get it? Get it. But I'm not going to endorse it on this program. I got hesitation about it. Okay? And the fact that it's synthetic, and I'm not saying that's the end of the world, but there's better, in my opinion. Okay? So that was a question from many, many of you, so I'm not going to even put a name to it, although a lot of them. Okay, let's get back to our questions here. And Noeline, hello, Noeline, comment ça va? Is there any truth that cottage cheese from goats cottage cheese, has a lot of progesterone in it? No, that's not true. That's not true. And by the way, I like progesterone. And but Noeline is asking a good question because she said it's not good for testosterone for men. That number one, that's not true at all. Okay, that's not true. And actually, progesterone, okay, hard to believe, progestation, progesterone is very, very important for a woman. But even men get a little bit of progesterone, guys, okay? You don't need a lot of it, obviously, but progesterone, I've never, ever seen that before, Noeline, that, stay away from goats cottage cheese because of progesterone. I've never seen it. If you can send me an article, I'll be happy to read it, but I've never had that in my experience at all. Okay, thank you for the question, Noeline. Judy had a mini stroke 2.5 weeks ago. Wow. Okay, let's see what is she asking? Okay, I would like to know what Dr. Martin thinks about rosuvastatin, 10 milligrams for lowering inflammation. Well, look, that's a statin drug. I'm not big on statin drugs. I got to tell you right up front, in Okay, my opinion. Okay? I don't tell people to take drugs or not take drugs. Even when I was in practice, I gave out information, but I wasn't like that. I mean, you got to make that decision with your physician. But when you're really educated and you do all the reading, you do your studying, I wouldn't have you on a statin drug. What's that going to do? It doesn't lower inflammation. And I'll tell you, I just read something on the weekend. Let me see if I can get it out for you. Okay, here it is. New study out, dementia linked to statins. Now, how many years have I been telling you that? Your cholesterol, guys, your cholesterol, your body is made up of cholesterol. You can't have hormones without cholesterol. They've made cholesterol the boogeyman, and I don't like it. I thought it was a crock in the 70s. Consistent. Blaming cholesterol for heart disease is like blaming the police because they're at the crime scene. Of course, cholesterol's in your blood. Of course, it's at the site of atherosclerosis. Why? It's trying to heal it. Lowering cholesterol, what's that going to do for you? Other than give you a lack of cholesterol in your brain. The whole premise of cholesterol was wrong right from the get-go. The whole premise. I was John the Baptist in the 70s. Repent. Cholesterol is not at the root of heart disease. It's not. It's a good guy, and they made it a bad guy. And people were in on it. Ansel Keys, Dr. Kellogg's and his minions, the food guides, the nutritionists, the dietitians, they all went for it, hook, line, and sinker. And they weren't right because, here's the proof. Heart disease is worse than ever. And we got just in America, we have 1/3 of the population. I can't get over this number. Just in America, we have 1/3 of the population on statin drugs. Man, I wish I would have invested in statins, Pfizer. I should have put my money on them, even though I never believed in them. Can you, the number one selling medication of all time are statin drugs. It gives me a migraine. And today, you can hardly get a doctor. They're so ingrained that cholesterol is a boogeyman. And here's what they've done. Okay? They found a medication, statin drugs. Crestor, Zocor, Lipitor, that lower LDL cholesterol. And it hasn't even made a dent in heart disease. Heart disease is worse than ever. Why? They're looking for love in all the wrong places. It's triglycerides. And having low HDL cholesterol, that's the problem. And I'll tell you, the more they study LDL, the more they study, don't play with LDL. You need LDL. You need it. Your immune system needs it. Your hormones need it. And the more they study it, the more they realize that what I was saying in the 1970s is true. What are we aiming medication to lower cholesterol for? Now, guys, I'm going to tell you something. You're going to have a battle on your hands, okay? So I'm not saying, Judy, not to take the drugs that they gave you. They gave you a blood thinner too. I'm for that. If you've had a mini stroke, you got to thin your blood out. Now, I would do it naturally, but anyway, I don't want to get into that too much. I just tell you that wouldn't be my treatment of you to give you a statin drug for inflammation. You're far better off to be on high DHA for inflammation, or curcumin, Navitol. Judy, thank you very much. We appreciate it. Okay, Louise, is there an upper limit for coffee? Yeah, I guess there is. Okay. I remember studying with a guy for boards. Okay, this was 50 years, more than 50 years ago. Wow. And that guy must have drank 20, 25 cups of coffee a day. Too much. Okay, look, but coffee's so good for you. Did I give you the new study on coffee? Hold it. I just got it here. Where did I put it now? Coffee, coffee, coffee. Is there anything like coffee? Hold on a minute. Let me just see if I can find it. Coffee is as hydrating as water. I brought that to you. I thought there was another one that I had. Very anti-inflammatory. Very good anti-cancer. And I put it in, I should do this, the 5 musts of weight loss. But I got more than 5. Anyways, maybe we'll do that this week. Okay. Yeah, there's an upper limit, I guess. I'll tell you what the sweet spot is, though, Louise. It's 4 cups of coffee a day. And that's been researched. Okay? It's been researched. That's what I do every day. 4 cups of coffee a day. 3 in the morning. Okay? That's me. And I have a decaf. If I have a coffee afternoon, for me, as I got older, I might not sleep as well as I want to. Okay? When I turned 50, I started drinking decaf at night. I had to. Okay? Decaf's good for you, by the way. It's the bean. The bean. There you go. Thank you, Louise, for the questions. We love you guys more than you know. Gwen, my husband has colorectal cancer. Okay. Had chemo, radiation. Wait a minute. And now he is, he's lost his libido. Very, very common. Okay. Here's what you want to do, Gwen, if he's willing to do it. You really want to get his testosterone up. And in my book, Sun, Steak, and Steel, I talk about testosterone in here. What the sun does for testosterone, what steak does for testosterone, what steel does for testosterone, and what sleep does for testosterone, and what coffee does for testosterone. It's all in the book, Sun, Steak, and Steel. How to elevate your testosterone. Okay? Get your libido in a man up. A lot of men today got so much estrogen, it's coming out their ears. And estrogen's a beautiful thing in women, not in men. So another thing that you might want to do is dim it out. Get them on some flax seeds. Dim out that estrogen. And very common, by the way, with radiation and chemotherapy. Just knocks you to the ground. Vitamin D, big time. Steak, big time. Steel, if you can get them in the gym. That'll come back. I'm telling you, one of the best things you can do for testosterone is get strong. Okay? Got the memo? Gwen? Tell him to call me. I'll tell him what to do. Maureen. What are your thoughts on radiation from taking a plane? Well, look, there's bigger fish to fry on a plane than radiation. I'm not big on that. Like, look, I don't know. It don't bother me. Okay? More dangerous on the plane is blood clots in legs, especially on long flights. Just the air in there and all, you want your immune system to be in. That's why I love Navitol, because they've shown in Navitol, first of all, very good for immunity, but you know what else is good for? Preventing blood clots. There's actually studies that show pine bark extract and blood clots. Radiation in a plane, I don't know. But if you're taking probiotics, I wouldn't worry about it even one iota, Maureen. And yeah, take vitamin D for sure. Vitamin D. Everybody needs it. Everybody. There's no exceptions to vitamin D. Everybody needs it. Okay, thank you, Maureen. We appreciate that question. Chris, I don't know if it's Chris a man or Chris a woman, but here's the question about bread. I know you were trying to negotiate. I don't negotiate with terrorists, Chris. Just teasing, okay? Because you're asking about bread. And you want to eat bread. And bread with more fiber, right, Chris? Isn't that better for you? No. But let me back up for a second, okay? Let me back up for a second. Chris, this depends, okay? Let me say this. If you're in the 93% of the population, those are not my statistics. 93% of the population have some form of metabolic syndrome, either high triglycerides, low HDL, belly fat, elevated blood pressure, slightly elevated blood sugar, elevated uric acid, low vitamin D. Those are the things that make up metabolic syndrome, okay? 93% of the population are on the Titanic as far as their health goes. Most of them have no idea because nobody talks to them about it. Okay? They're on the Titanic. And for me, no bread for those people. Okay? No bread for those people. Now, you do the reset and you find out how much better you feel when you're not having carbohydrates, okay? And I'm not saying you're going to go through life without carbohydrates. I'm not saying that. I never have and never will. I'm not a carnivore guy forever. You could be, okay? You could be carnivore for the rest of your life. You'll live well. I got no problem with that. But for most people, that's not doable. And I want people, I always give a plan to succeed, not to fail. I don't want people to fail. I want a plan to succeed. And guys, I was in the weight loss business. I was in the health business for a long time. And I was a guy that pumped up people's tires, and I got people to change their lifestyle, to get off the Titanic and stay off the Titanic. And to change habits. And so, I got to tell you, I'm not saying you can never have Let me make sure. I got a brain cramp here. Chris, I'm not saying you can never have a slice of bread. Probably the best bread that you could eat is sourdough bread. Rosie's bread is it on our website, girls, or you got to ask Jeanette and Nicole where to get the recipe for Rosie's bread. But it's a much lower carb bread, for sure. But again, at the end of the day, it depends, Chris. It depends on where you are at personally. And if you're all right metabolically and you have a slice of bread here and there, I got no problem with that. I really don't. But most people, 93% of the population, them and bread don't get along. I don't care how much fiber is in that bread. Okay? I really don't. You can go to the grocery store and you can get low carb bread, right? You can get keto bread. I wouldn't touch it with a 10-foot pole, in my opinion. Okay? Got the memo? It does convert to sugar a little bit slower, Chris, but at the end of the day, it's still a crappy carb. Bread, pasta, rice, cereals, sugar, sweets, pastries, muffins, bagels. Oh, Dr. Martin, it's 17 grain. I don't care. It don't matter. It's going to be sugar rapidly, and you need a lot of insulin. And the key to getting off the Titanic is insulin. Get it down. Okay. Thank you very much, by the way, Chris. Yeah, I like the way you study, Chris. You're reading. And I want you to ask the question, but you got to understand where I come from. Okay? You got to understand that. Okay. Thank you very much. Ben, can genetic hemochromatosis be turned off? I don't know. Hemochromatosis, by the way, is high iron in a person. Okay? We see it a lot more. I gave you two big reasons for it, and I've talked about it in previous podcasts. Okay? Hemochromatosis. Why do we see so much more of it today? Fatty liver. Now, can be genetic predisposition, but the biggest reason that we're seeing so much more hemochromatosis today, it's not because people are eating more iron in steak or whatever. That's not the issue. The issue is they're eating more sugar and they're drinking more fructose. And they're drinking juices and their liver is all packed up. And I tell you, that's the number one reason for elevated hemochromatosis. And insulin resistance, a big factor in hemochromatosis. Okay? Now, to get rid of hemochromatosis, like some people might go give blood, get it out of their body, chelate it out of there with chelation therapy. But I tell you, when you empty that liver, if you do the reset, I don't care you're eating steak. That's not going to give you hemochromatosis. It never has and never will. Thank you very much, Ben. Can you turn it off? If it's genetic, I don't know. It's a good question. I don't know if you can reverse it, but you can sure take care of yourself. Okay, Thania. I have a reading of B12 at 1500. Well, it's not, look, I like 800 to 1200 B12. Okay? I like it in that range. It's optimized when it's in that range. If it gets a little bit higher than 1200, so what? Like, I'm never concerned about high B12. I mean, I like ideal, I like optimized, but high B12, remember B12 is a water-soluble vitamin. And if you go way too high in it, it usually means you don't need it anymore in terms of a supplement. Because I had tens of thousands of patients on B12. I still recommend it big time. But what happens if I told you this story before, but we always have new people, so I'm going to tell it again. I had a family doctor call me, and she actually loved me because she came to see me. Okay? And she said, Dr. Martin, I have one of your patients and one of my patients, and they got very high B12. And she was very worried about that. And I said, Doc, I'm going to ask you a few questions, okay? Number one, B12. Yeah. Water soluble or fat soluble? She said, I don't know. I said, it's water soluble. What's that mean? And she said, I think you can't get too toxic on it. I said, yeah, right. Even fat soluble vitamins, you ain't getting toxic on that. Nobody's ever seen it. They just talk about it. Okay. So I said, okay, got that? Number one. So if your patient and my patient has high B12, what happens? Well, that's why I called you. I don't know what happens. Is it dangerous? I said, absolutely not. Okay? Now, that's a little bit higher than I like in terms of optimizing, but I said, so what? They can just stop taking B12 that I gave them. That's all. Eat steak. Okay? Eat steak. Liver. I wish I liked liver. I don't like liver. I hate liver. But it's good for you. Okay. Okay, thanks you for the question. Thania. Francis, what causes dry, itchy skin in the ear? Yeast, fungus, candida. Comes leaky gut, leaky ear. Leaky gut, leaky scalp. Dandruff, fungus, yeast, skin, yeast. Most skin conditions are fungal based. It's dysbiosis in the gut. And don't feed the bears. Don't give it sugar. Okay. Itchy ears. Okay. I think a couple of more. Jolene, is ivermectin good for us? Well, ivermectin got a bad rap during COVID. It shouldn't have. Okay? I would have recommended it during COVID. I'm a natural guy, so I'm not necessarily, that's a dewormer, but it's got some real good antibacterial, antiviral properties. It should have been given, in my opinion. I wouldn't take it just for nothing. Okay, ivermectin is still a medication. I'm bigger on vitamin A, vitamin D, probiotics than ivermectin. But I got, now they're showing ivermectin might be good for cancer. Hey, if that's the case, and the reason is, by the way, I brought this to you the other day. There's a lot of doctors, I'm exaggerating. There are doctors today, many, that talk about all cancers are yeast or mold or parasites. And ivermectin, antiparasitic. But so's oil of oregano. Okay. So are broad spectrum probiotics. Jolene, thank you for that question. Joanne, is eating EMC, eggs, meat, and cheese, consuming meat, okay, given those bowel issues, genetic bowel cancer, and regular colonoscopies, polyps, hemorrhoids? Joanne, the best thing you can do for your bowel is eggs, meat, and cheese. The worst thing you can do for your bowel is fiber and living on fruits and vegetables. That's the worst thing you can do. And sugar, you know how sugar destroys your teeth? Sugar destroys your gut too. So medicine, I'm sorry, they got it 100% wrong. And the reason we have much more colorectal cancer today is not because we're eating more meat. We're eating less meat than ever. And we got more cancer, more colorectal. Too much sugar, too much fiber. I'm telling you. I'm telling you. This whole thing with red meat and colon cancer, I'm telling you, when the world out there tries to get rid of stuff, it goes on steroids of stupidity. Steroids for absolute stupidity, telling people to stop eating red meat with your colon. Your bacteria, okay, your friendly guys, they love steak. Cancer hates steak. Did you not read my book, Sun, Steak, and Steel? Cancer hates steak. Can't feed on it. Okay, guys, we love you dearly and sincerely, and we'll talk to you soon.